Okay, the fifth tip for managing mental health symptoms is to exercise. So, exercise is one of the absolute best science based anxiety and depression management techniques. And I know that gyms are closed for at least the next few weeks, but there's so many great exercise videos on YouTube. There are a lot of gyms and other fitness professionals streaming live fitness classes online. You can order some inexpensive weights if you want to do strength training on from Amazon, and you can order exercise mat, whatever you need to be able to exercise in your space. You're also allowed right now to go outside and exercise as long as you keep a safe distance. So anywhere from 30 minutes to an hour each day is really going to help with lowering stress, anxiety, and depression symptoms. The sixth tip is to reach out to your support network. So I think what's really important is to realize that social distancing does not mean social isolation. I keep thinking about how fortunate we are to have the technology that we have right now that allows us to connect virtually with all of our loved ones. So I was thinking about what if this would have happened in 1990 when there was no text messaging and nobody had internet in their households. So now we can use FaceTime, Zoom, Skype, Google Hangouts, whatever you use to be able to reach out and virtually hang out with friends, family, loved ones. So now's a really great time to send a text message or make a phone call or video chat someone who you think might be lonely or socially isolated, or just a friend that you haven't connected with in a while. I also want to point out that professionals like a mental health professional or a therapist are also an important part of a support network. So if you've seen a therapist in the past, or if you would like to get mental health services now, I'd really encourage you to reach out to local therapists and see if they'd be willing to see you online for telehealth services or through the phone for a phone session. I also read that our counseling center will be offering telehealth services, so basically video chat services, if that's something you're interested in, to reach out to them and connect. Okay, number seven, really important, is balancing your thinking. So here is a graphic with some common thinking errors, or what we sometimes call cognitive distortions. These are all automatic negative thoughts that we all have on a typical day, but especially in heightened times of stress, we're all probably having these often throughout the day. They're completely normal to have, so the goal is not to eliminate negative thinking. The goal is also not to just do positive thinking and think that replace your negative thoughts with positive thoughts. Instead, what we want to do is really balance our thoughts. So, thinking about the absolute worst case scenario, which is called catastrophizing, is likely to heighten our anxiety. So, for example, if you found yourself thinking in extremes right now and thinking about the worst case scenario over and over again, that's going to just raise any kind of mental health symptoms that you're having. The all or nothing thinking, where you think things like, we're never going to get back to normal, or it's always going to be like this. Jumping to conclusions, disqualifying the positive, all of these are things that we're probably doing a lot of right now. So I'm going to show you one strategy for helping with these automatic negative thoughts. And so I got this worksheet from a really wonderful clinical psychologist, Dr. Neil Aronov from Memphis, who was an amazing supervisor to me. And so one thing that you can do is to really monitor your thoughts. So the first step is just to notice your thinking and then notice how that thinking is making you feel. So obviously a pandemic is a triggering event, and a lot of us are probably having toxic or at least unhelpful thoughts. So an example would be something like, our economy is going to be ruined by this. When we have that thought, we're likely to have a lot of fear, anxiety, depression, sadness. And so the antidote to that is really just a more balanced thought. So, what are some other thoughts that we could have to counter the thought that our economy is going to be ruined by this? Well, you could say something to yourself like, Our country is taking steps to support families, ensure businesses can reopen when this is all over, or something like if we all come together and take these precautions seriously, our economy is going to rebound quickly. Again, you don't have to flip to positive thinking where you say everything's going to be wonderful. Instead, you're really just trying to balance your thinking and stay away from that catastrophic thinking where you're always just thinking about the worst thing that could happen. So there are apps you can use to track your thinking. You could use an old-fashioned worksheet, you could write them down on your phone, but I do this all the time anyway, where when I notice myself having a negative thought, I really just try to counter that and have a more balanced thinking, and that really, really will affect your mood. Okay, tip number 8 is get outside if possible. So the weather has been all over the place, at least in Kentucky. We've had a ton of rain in March, so it's been a little bit hard to practice this one. But any period of time where it's even decent outside, right now the guidelines are stating that we can still go outside as long as we maintain 6 feet of distance from other people. So my husband and I went to the Baker Arboretum in Bowling Green yesterday, and there was absolutely no one there. It was really pretty. Everything was in bloom. We went to Mammoth Cave. Again, there were people there, but it was not crowded at all. So getting out, taking a hike, going places in nature outside of a pandemic has been shown to reduce anxiety, to improve depression. So this is something that you can practice as much as you can to try to improve your mental health during this time. The ninth tip is to really practice healthy habits and also self-care. So we hear a lot about self-care and it's really personalized to the individual. Anything that helps you throughout a tough time feel better, feel normal, feel grounded, those are things that you're going to want to do more of right now. Other really important tips and healthy habits. The first one is to eat healthy food. So when we're stressed, we tend to crave sugary and processed food. I know this week I ate almost an entire box of Cheez-Its by myself, which I haven't done since I was a child. And that's just because I was really stressed and I was stress eating. So if you've done that, be kind to yourself. We're all going to have times that we do that throughout this stressful period. But for the most part, if you can up your intake of healthy foods, fruits, and vegetables, you can improve your immune system and actually help your mental health symptoms as well. The other two big tips here are to limit alcohol and caffeine. So, excessive alcohol use can actually depress your immune system and make you more likely to get sick. It also can heighten anxiety and depression symptoms. So, we want to limit alcohol to the recommended guidelines: no more than 1 drink per day for women, no more than 2 for men. Definitely not more than 3 drinks in a drinking day for women, 4 drinks on a drinking day for men. Also, caffeine directly stimulates the nervous system, so lowering your caffeine intake can really help to reduce feelings of anxiety. And I just want to say, although right now, of course, you're expected to keep up with your schoolwork, it's totally normal if you're having trouble concentrating. I know I've had a very hard time concentrating on anything work related this past week. Everyone is struggling with that. You are not alone. And this really isn't the time to obsess about being productive. Instead, just being kind to yourself, beating yourself up is not going to help. So, talk to yourself as you would talk to a good friend that's struggling to get yourself through this time. That's a form of self care, being compassionate and kind with yourself. And my last tip is to do anything that you can right now to help others. So, research has actually shown that finding ways to help others boosts positive emotions and decreases anxiety and depression. So, some ideas: if you have any time or money to help an organization right now, you can order takeout, buy gift cards from local restaurants or shops, give to a local food bank, donate to a local organization, something like the Humane Society or something local in Bowling Green. Giving blood is a really great idea because there are blood bank shortages throughout the country right now, and they're setting up precautions so that that is a safe thing you can do and feel good about actually saving someone's life. Reaching out to others and social connection is also going to be really helpful for a lot of people right now. The other biggest thing you can do right now to help others is to take the precautions seriously. A lot of the science coming out right now is showing that the people who are transmitting this disease, a vast majority of them are not showing symptoms. So just because you're young and healthy, that doesn't mean that you're in the clear. You can spread this to other people who are vulnerable, people with suppressed immune systems, people who are older than 65 years old. And then also, we're seeing a lot of young people actually being hospitalized for this right now in this country. So, taking the precautions seriously, practicing social distancing, washing your hands if you do have to go out, or using hand sanitizer with alcohol, at least 60% alcohol content if you do have to go anywhere. But really, just staying in is the best option right now. And as soon as we do that, the more people that do that, the quicker we'll get through this. The longer people continue to not take these precautions seriously, the longer we're going to have to do this. Okay, so finally, I just wanted to say that this is going to be obviously a really difficult time for all of us. So I really hope that you guys are able to focus on the things that you can control, and I've listed some of them here in this slide, and to try to let go of the things that we can't control right now. I know I'm going to be practicing all of these anxiety management strategies because I know my anxiety has been really high lately, and I hope that you'll try some of them too. And I also want to say that if you do have days where you don't do any of these, and I certainly have been having those, and instead you just stare at your phone all day, don't beat yourself up about it. That is a normal reaction, and your brain is trying to keep up with all of this information. And again, fear, anxiety, those are normal reactions to be having right now. So in the description section, I'm going to be sharing links to a whole bunch of professional resources. There's one Google Doc that I'm going to be sharing that has a ton of resources and links for other from other mental health professionals. So please look at that if you're interested. Also, please reach out to me with any questions that you have. Let me know if there's any way that I can support you throughout this tough time. I'm going to be checking my email frequently, so I will be able to get back to you very soon.